Hi, my name is Chelsea Elder. I am the Executive Director for Adaptive Adventures, and I am so excited to share our organization with you today. I got started with the organization in 2010 as a volunteer and have held many roles within the organization, but I have been the Executive Director since 2017, and the organization means so very much to my family. My dad was a disabled Vietnam veteran, and for the last 5 years of his life, I was his caregiver. You may think that it would be easy for me as the executive director to get my dad out participating in the programs that we provide for veterans, but it was not. He was resistant. He was scared to talk with other veterans. He hadn't interacted with another veteran for over 37 years. When he came back from Vietnam, he reached out to one of his buddies who was also deployed at the same time, and unfortunately, the next day he completed suicide. And my dad carried that guilt and shame that he had caused his friend's suicide for the next 37 years. He didn't identify as a Vietnam veteran, and he was scared to go to anything related to veterans. So finally, one day I convinced him to come out to our dragon boat racing program. He was worried that they were going to tell war stories, and I told him, "Dad, they may give you crap because you're Army, but they are not going to tell war stories. It will be just fine." He came out, he ended up falling in love with it. And not only did it provide him with joy and freedom and exhilaration, but it provided me as his caregiver time for respite. I was able to send my dad on adventures and trips and get time to myself to recover so I could be the best version of me as a caregiver. Across the US, 1 in 4 adults live with a disability, and far too many face isolation, inactivity, and barriers to participating in outdoor recreation. Veterans in particular experience higher rates of depression, PTSD, and physical injuries that limit access to community-based recreation. According to the National Institute of Health, veterans are about 1.5 times more likely to die by suicide than non-veterans, and female veterans are more than 2 times as likely compared to civilian women. According to the VA, fewer than 15% of veterans with disabilities regularly participate in physical activity, despite strong evidence that it improves both mental and physical health. We see this gap every day. Veterans who used to live for the outdoors, to ride, to climb, to paddle, now believe those doors are closed. Then they come to an Adaptive Adventures program and rediscover what's possible. I have created a short video for you that showcases an overview of the organization and the impact that it has on veterans' lives every day. Let's take a look.
What if one moment changed everything? What if you were told adventure was no longer for you? The reality is, 1 in 4 US adults lives with disability. That's over 60 million people. At Adaptive Adventures, we believe the outdoors doesn't belong to a select few. It belongs to everyone.
So this got me from sitting in front of TV, because I kind of fell into a slump that I wasn't contributing to the world anymore.
We're not just an adaptive sports agency. We are reshaping the future of outdoor recreation. Built by pioneers, Paralympians, and Adaptive Sports Hall of Famers, our team helped launch the adaptive sports movement. Today, we stand as something bigger, the inclusive and accessible side of the outdoor industry.
I never would have thought I could do it. I stepped outside of the box, stopped saying, "Woe is me," and I just did it. Family members, friends have told me I couldn't do it. Whatever, proved you wrong. And guess what? I got my first medal.
Unlike others, we never charge for our programs, and we always include families, because adventure is more powerful when shared. As the nation's only fully mobile adaptive recreation program, we deliver thousands of life-changing experiences each year, across more than 30 states and territories. From the parking lots of VA hospitals to mountain ranges and rivers, we ensure no one is left on the sidelines. Our signature initiatives reach people in powerful ways. Adaptive cycling clinics open the road for freedom and independence. Our Student Solutions program partners with engineering schools to invent the next generation of adaptive equipment and technology. The Adaptive Education Center serves as a national hub to train, innovate, and maintain life-changing adventure. And we extend impact further, training park districts, cities, REI, climbing gyms, bike shops, and outfitters, helping entire communities become more inclusive and accessible. The result? Improved health, stronger families, connected communities, hope, and healing through adventure. Last year, 87% of participants reported better physical health, and 90% felt a boost in mental well-being. Because when barriers fall, people don't just rediscover adventure, they rediscover themselves. This is more than sport. This is freedom. This is healing.
If programs like this didn't exist, I think we've seen it. The consequence is loneliness. And when somebody has nothing, then they have nothing to live for. It's nice to have people that get it. They understand what it takes to keep going. And that means a lot. That could save a guy from taking his own life.
This is a movement. We're proving every day that the outdoors doesn't belong to a select few. It belongs to everyone. Join us and help reshape the future of outdoor recreation.
Let's go again tomorrow?
Yeah, let's do it.
Let's go.
Adaptive Adventures measures success and outcomes through multiple different avenues, including data and statistics that we gather within our database, such as how many unique veterans were served, how many caregivers were served, how many participation days there were, locations served. And then we also use a unique Thriving Score survey that we developed in partnership with the University of Illinois. Last year alone, Adaptive Adventures delivered over 11,000 experiences across 30 states and served over 3,000 unique veterans and their families. Through our Thriving Scores evaluation model, we measure outcomes such as 87% of participants reported improved physical health, 90% reported better mental well-being, and 82% reported stronger sense of belonging and community connection. Our approach is unique and innovative. As the only fully mobile adaptive recreation program in the country, we travel to establish and sustain programs in unserved communities. We train local disabled veteran leaders how to run their own programs and provide them all of the tools, resources, and administrative support to do so ongoing. Our programs are provided free of charge. We include families, and unlike site-based organizations, we bring the programs directly to the people. Each year, we partner with over 38 VA medical centers, bringing our programs directly into the parking lots. This approach provides a warm handoff from the VA therapist to Adaptive Adventure staff, helping the veterans to feel less uneasy about coming out and getting active again. With this funding, we will continue to expand our services, specifically focusing on several very important initiatives to us. We have hundreds of veterans waiting on wait lists to be able to experience our adaptive cycling clinics across the country. We are looking to add more locations, but with more locations comes more logistic, staff time, and funding. And through our program, veterans can qualify to receive their own adaptive cycle through the VA, but they have to have so much time in the equipment and try a variety of equipment to qualify. This is a savings of anywhere from $7,000 to $35,000 for the veteran. At Adaptive Adventures, we believe that when you give someone the tools to move again, physically and emotionally, you give them back their freedom. Where adventure moves us, community holds us, joy heals us, and freedom begins. Thank you for considering us. Your support would not only change lives, it would help restore purpose, belonging, and healing for those who have served our country. Thank you for believing that adventure is for everyone.